all patients presenting to Moorfields with infantile nystagmus, we managed to filter out 22 of them after they've had thorough ophthalmic testing, neurological examinations, you know, the macular scans, the ERGs, the VAPs, and MRIs, even when it was indicated, and had either panel testing or whole genome sequencing. So we identified 22 of them, which we thought these are absolutely idiopathic. 60% were, this is a bit of a summary of their demographics. 60% were male, about 40 female. We had no consanguinity, and their age of presentation of their nystagmus was about 2.7 months. Most of them were white British, about 27%. However, we had 45%, their ethnicity was not even stated in the medical records. The visual acuities were about 0.4 logmar, which I think is 615. And we managed to get 19 out of the 22 OCT scans, which 3 of them were very poor quality, but about 60% had a normal foveal architecture and 26 of them had a very mild foveal hypoplasia. We also managed to get from 86% electrodiagnostic testing, and none of them showed intracranial chiasmal misrouting, which is typical of albinism. And this is just an example of most of their imaging, like the color images showing healthy optic nerves, normal fovea, also on the autofluorescence. And as you can see, all the outer retina and all fovea is very showing normal structures. And this is a summary, a table of their demographics when the waveform of the nystagmus was horizontal or pendular in I think all cases we had. And this is, yeah, somehow my cursor is going automatically. Let's see. So we found 7 mutations in the FRMD, of which one of them was a novel variant. It was a frame shift. It's the 4th one, which was predicted to result in a truncated protein in the conserved end terminal of the FRMD7. And most of them were likely pathogenic or pathogenic. And only one variant we found in the GPR143, which was not a variant causing albinism. And as you can see, 1/3 of them were nonsense mutations, 1/3 missense, 1/3 splicing, and the frame shift mutation, which I just mentioned. So in conclusion, we managed to find a molecular diagnosis for 36% of the idiopathic cases. And it's always, I think from the ones that were not diagnosed, most of them were panel and only 2 of them were whole genome sequencing. So there's still a lot that could be done in just reviewing their data. Hopefully we could find more for the future. And it will always be a challenge, because even inherited retinal dystrophies, young children, when you look at their fundus, looks perfectly normal and present also with nystagmus and could be misdiagnosed. So yes, I hope this was my last slide. This is the study we published, and these are all the authors, which I also like to mention and thank for the contribution. It was a unified effort. I didn't do it all by my own. And yes, thank you very much for your for listening to my talk.